Yeah,
start
here, I'm gonna
talking
actually
for
stop and
real.
then record myself because
Oh, okay. Yeah,
okay,
no problem.
cool.
Um, yeah, I think, yeah. And, in the audience is, I think I anticipate it probably being more female than male, but I hope that some men will want to listen to women who have just kind of done interesting and unique things.
Yeah.
Um, and age range is, anything from somebody who's in college and trying to decide what they want to do with life. And cursing is not, I don't think Apple likes too much cursing, but like, I don't know. I've said shit. So people have said shit. So,
I'll try to tone it
I
down.
don't
I will unfortunately
know.
probably say the word penis a lot when I'm talking about
No,
my job.
that's your,
So
it's your job. You can be like penis, 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 it's
no,
fine.
it's funny. My story about that is, I went on Dr. Drew's radio show. Like he has a
Yeah.
podcast, but he also has a radio show, and it's live on a fairly conservative talk radio show in like the middle of the day. And he was talking to
That's
me,
awesome.
and we were talking about urology. So we're saying like penis, 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 penis. And I walk out of the room, and his like editor guy was laughing so hard, and I was like, "Why are you laughing?" He's like, "Because you're two MDs, I didn't have to bleep that." But I don't think there's ever been the word penis so many times on like conservative talk radio in the middle of the day
That's
ever.
perfect.
But
That's
it's true, because in
awesome.
our context, we're
Yeah.
not cursing or using it in like a lewd context. We're talking about,
Right.
a professional thing, which
Yeah.
is,
Yeah.
but
Totally.
yeah,
So cool. All right. Well, we'll
cool.
just roll with it and probably be about half an hour ish or something like that. We'll see. And I'll pause for a second and then we'll go. I'll have introduced you and done like read your bio and everything before we start. So that's kind of
Okay,
where
cool.
we'll be picking up. Okay. So I'll pause.
Yeah.
Hi, Ashley. Thank you so
Hi.
much for being on.
Yeah, thank you so much for having me. It's an honor. I hear you have some other really exciting guests, so I feel honored to be included on your roster of women.
Well, I was really excited when you agreed to do this because we've been acquainted a little bit just from chatting online, and we've had a little bit of a connection before this. But, now I get to ask you all my questions I've been dying to ask another female in a surgical field who works in an area where there just aren't a lot of men, and kind of hearing the compare and contrast and hearing how your experience was similar or different to mine.
Yeah.
What I'd like to start with is just asking you a little bit about how you grew up, where you grew up, and what kind of brought you from who you were as a child to where you are now.
Yeah. So I grew up in New Jersey. I have I'm one of four kids. I have two sisters and a much younger brother. So I definitely grew up in a household that was very like, for the most part, until my brother came along much later, four women and one man. So, I don't know if that really like makes you who you are, but it was definitely an environment that was very female dominant. And my dad is just a really, really nice guy. And I would say our household was very egalitarian, I mean, he just did like tons of chores and cleaning, and it was never kind of, I don't think there was any like gender-based role in the sense that like this person always has to cook and clean, and I
Mm-hmm.
just never even conceived of that. And I think actually it took until, I was older and kind of in relationships and spending more time, it meant, different guys I was dating's household, seeing that kind of other people's family paradigms were not necessarily like that, like they didn't have loud moms who were just telling everybody in the house what to do. Like,
Right.
and again, I don't think that necessarily makes somebody who they are, but I think that I had a lot of modeling in my mind that there was no concept of what a woman had to be, in these sort of traditional roles. And I don't know. I mean, yeah, I don't know. Typical like upbringing. I was very good at math and science, and that's how I ended up going into engineering undergrad. Was my dad was an engineer, and my granddad on my mom's side was an engineer, and I kind of just, I'd love to say that I was dreaming big as a kid, but I was kind of just like, oh, when you grow up, you have a pragmatic job that you're good at that makes you a middle-class salary. And so I just figured I would become an engineer. Like I didn't necessarily dream of that. I just figured that that was a good idea to do that. Yeah, so then I undergrad went to engineering school, and during that process, worked at the company my dad worked at, which is a military defense contractor company. Like my dad works on missile tracking systems. Good job security. If people are ever thinking of what to do, get into build things for the military. You'll always have a job. And I was working on power supplies for missile tracking systems, and I was so bored. And like I liked engineering as a student. I mean, it was really tough. Like it was really tough, those classes, but I liked it. But then sitting in a cubicle with no access to daylight for 10 hours a day, I was like, shit, I cannot have a job where you spend your entire adult life going to some office park and sitting in a box. I just can't do that. And there were no doctors in my family, but I started looking into careers, and that was kind of what took me into the next phase of life.
I think for some of us, like the idea of sitting in a cubicle and not seeing the sun for a while, I don't know, I don't see the sun from the OR, but that's besides the point. But I mean, sitting in a cubicle or having to like wear a suit every day, I think a lot of surgeons feel like, oh my gosh, that just sounds like a nightmare.
Yeah, no, for sure. I will say though, there are definitely less so now, but in residency, those times when you had been, awake for 20 hours straight and you were exhausted and you had been standing forever, and you're like, wow, sitting in a cubicle for 8 hours sounds amazing. Why didn't I do that? I could have slept every night. Like I could have slept every night.
I could get up and pee whenever I want and go get a drink of water. So glorious.
Exactly. Like talk about a kind of gross female-based story. So I remember in residency, our third year of residency, we kind of took like a ton of call, and the hospital was a super busy hospital in New York City. And I remember one night, I had been running around all day. I had been up all night, like doing stuff, seeing consults, whatever. And then the next day I was operating. And it was probably like, I don't know, 2 p.m. the next day. And I had been so busy. And the nurse comes to me, like the circulator nurse comes to me, and she brings me a pair of like new scrub pants. And she's like, here, put these on. And I was like, why? And she's like you've got something on your butt. And I had like been wearing a pad and a super tampon both, and like had bled through both and my pants. And I had not even noticed because I was so busy.
Yeah.
And I was walking around with my period all over my pants. And like and if you want to
thank goodness for that
TMI,
nurse.
if you want to cut that out, this is TMI, you can definitely do that.
No, but this is reality. I mean, it's like we do these fields where there are normally a lot of men. We work in these fields where there are a lot of men, and they are not dealing with periods. And so this is a reality. This is a reality where, during our training, we spend hours upon hours, like, 24 hours plus without having eaten anything sometimes. And so this is real life. It is.
Yeah.
It is what it is.
One of my co-residents, I remember she was like in her 3rd trimester of pregnancy, and she was just pushing herself so hard because you don't want to be considered kind of like weak. And I remember she ended up getting pneumonia and septic, and she like was still working until they told her she like had to be hospitalized, and and obviously like that was the work ethic that we all had. But like when you're in your 3rd trimester of pregnancy, it's like, it's just a whole different ball game. But I think there was kind of, I think our program was as good as it, I think it was pretty good, but I think there was kind of suboptimal understanding of what it's like to be pregnant, amongst our leadership, because we, I think it was a big academic department, and we probably had 30 people on staff, and there had been one female attending, and then she left, and they did not replace her with another woman. So none of the mentorship was anybody who had any idea what that was like,
Right.
Yeah.
Right.
Yeah.
At least not firsthand.
Right. I mean, yeah.
Yeah.
Yeah. And I mean, I haven't been pregnant, but whatever.
It's on the
Still.
radar. It's on the
Right.
radar at least.
Right.
So, I tried to look up this number, and please tell me if it's incorrect, but is it about 8% female urology attendings at this time?
Yeah, it's currently 8% in practice. It's been changing a lot, and in recent years, and it probably has a lot more. I don't know how ortho is now, but about
We're
30% of people matching now are women, which is like a
I
huge shift.
Yeah, I saw that number too. And ortho is definitely getting up there for women matching and women in residency now. But I chose the name of the podcast, the 6%, because we're only about 6%. And that was one of the more recent quotes of how many women are actually in practice in ortho.
Yeah.
How did you, after you got into medical school, like, or maybe when you applied to medical school, were you like, I am going to be a penis doctor, or no?
No,
Or did it
actually,
come, or how did that happen?
yeah, it's a great question. So I actually, when I decided to reevaluate my career choices, when I was working in the engineering job in the cubicle, I said, okay, what can I do that's kind of, science or math or, kind of content that I knew I was good at. And then, but also kind of more dynamic, like more physically
Right.
doing things. And somehow was like, oh, maybe I should look into being like a doctor. I had never even thought about that. I don't know. Nobody in like my extended family was a doctor. And around that time, one of my family members had been to see a urologist. It was for like a pretty mundane thing. Like, I'm not going to say I went into urology to fight for the problems that like people say like, oh, my father had cancer and so I became an oncologist. Like, it wasn't like that. They went there and they had a procedure done at the office, and they came home and described the procedure. And I was like, oh, that sounds cool. I was like, maybe I should go be a urologist. That sounds cool. And so literally I just decided to go be a urologist.
That's awesome.
And I applied to med school. I told everybody I was going to be a urologist. And they're like, little girl, do you have a urologist for your father or something? How do you know what this is? And I was like, no.
And I know I said penis doctor, which is like only one part of what you do. Obviously, like there are urologic issues in men and women and everything, but that's, I think, a little bit of the running joke, right? Like that's
For
kind
sure.
of one of the things you deal with. But obviously our listeners are not all in medicine. So can you tell us a little bit about what your day-to-day is like and the kind of surgeries that you do and the different problems that you deal with?
Yeah. So it kind of, to take a step back, urologists as a whole basically, are the main people who do surgeries on the urinary tract. So from the kidneys and the bladder, and as well as, surgeries of the male genitalia. And there is some overlap with gynecologists in terms of female surgeries for urinary leakage, etc. So in terms of me, I personally did kind of go the more penis route somehow. And I, in addition to doing general urology stuff that we do when we take calls, like kidney stones, and putting in catheters, and people who have like flesh-eating scrotal infections, fun things like that. My main area of specialization is kind of surgeries related to male sexual function. So I do implants of inflatable penile prostheses, which is,
I bet there are a lot of people out there who don't even know that exists.
No, most people have no idea that exists. Like, most people have no idea. It's incredible how few people know, which, yeah, I don't know. It's fascinating. I mean, they've been around basically since the 1970s, and, they're FDA approved and they're covered by Medicare, and they're like a legit thing. But yeah, for sure, people don't know. And even people I've spoken to who kind of, through my podcast, who are kind of in the realm of like sex education and stuff, really have like very little understanding of what those are, which to me is kind of fascinating. but I do that, and then I do a lot of work with something called Peyronie's disease, which is basically where, you know, you have a bent erection. Usually you wake up one day in your 50s and suddenly it's bent, like, you know, anywhere between slightly to kind of, you know, more than 90 degrees. And so there's various procedures you can do to help correct that, or
I had no
straighten it out.
idea it just like came on suddenly.
Yeah, it usually just comes on suddenly.
Wow. I thought it was something that was either chronic or maybe that they're born with, and then you do the correction. So I'm learning something today.
Yeah. No, and there are people with congenital penile curvature, but the vast majority of people who have Peyronie's disease basically kind of just wake up one day.
Wow. And it's like, surprise.
Started. Yeah. Yeah. Or they have
Wow.
like pain, and then 2 weeks later the curvature begins. But, you know, and we don't really know why it happens, but it's some thought that it's kind of like repetitive micro trauma to the penis. And then it's kind of like this aggregated trauma that kind of you develop this scar tissue. Why at this specific time, I don't know, but you know, that would be whatever. Anyway, so I do a lot of penis surgery. So and it's interesting because out of our group of urologists, you know, I think there's probably 17 to 20 of us in kind of our like big group, you know, under an HMO. And I'm the one who does the most penis surgery, and I am, you know, the second youngest and a woman of our group, you know, so somehow, and I will tell you, you know, I'm the kid who was like so shy in high school. Like I never went to prom. Like I was terrified of boys. Like if you had asked somebody in my graduating high school class, like if that girl, you know, who was like on the biology team and didn't talk to anybody would have been like a dick surgeon, like they would have lost their mind, you know.
You probably would have lost your mind.
Oh, I would have lost my mind too. I would have told you were an absolute lunatic. And you know, I'd say to the point of empowerment in that regard, you know, you shouldn't define what you can do in your life by the person you are at any one time. You know, like if I had said, oh, because I'm shy, I could never be a surgeon because surgeons aren't shy. Well, like, no, the process of becoming a surgeon made me less shy. You know, I just had to deal with people. And the process of, you know, approaching men kind of in a professional context probably made me more, you know, strong-willed and confrontational. Well, appropriately so, but you know, it wasn't like, oh, you can't do this because you're scared of this. You just do this, and then you become, you know, and I would to that extent like stress, you know, for people to you know, kind of push themselves outside of their comfort zone, you know, and surprise themselves with the things that they can do. Yeah.
I think that's how we grow.
Yeah, for sure. Yeah.
So how often are you, as a female doctor, a female surgeon, mistaken for not the doctor?
All the time. All the time. Or there's things like I walk in the room and I say, hi, nice to meet you, I'm Dr. Winter. And they said, oh, I was actually I was expecting you to be a guy, or I've gotten, oh, I was hoping you were going to be a man. That was another one. Which is like, can I tell you, I mean, first off, my first name's Ashley, and I know that probably 100 years ago, that was a more popular name for dudes, but like for a long time, that hasn't been. And second off, my profiles online, like you can figure out that I'm a lady. Like it's not, I'm not hiding it. And what else have I been told? So yeah, I was hoping you were going to be a guy. I was expecting you were going to be a guy. I remember I walk in one time, like when we do vasectomies, right? The guys are just awake and it's in the office, and they do an online module for the counseling. So when we meet them the first time, they are like pants off, balls out, ready for the procedure on the table. And so this guy's like laying there on the table with his balls out, and I walk in the room and he literally said to me, oh, I was hoping you were going to be a 60-year-old white male.
That's
and
so
this guy,
specific.
I know, and this guy, like, I know he was kind of joking, but he was probably 30 and he was not white either. And I literally looked at him and I was like, dude, you're not a 60-year-old white male. Like, it's like, yeah, I guess. And I was like, well, look, you know, if you want to reschedule, I have a partner who's 60-year-old white male, so you can schedule them. And he's like, no, it's okay.
I'm sure at this point, with you having been years into practice, it is way more awkward for some of the patients who are expecting something else besides you than it is for you. You're very matter of fact about it, I think, right?
Oh yeah, I mean, it's definitely one of those things that, you know, I don't take it personally. And I also am just very upfront about like saying to somebody, you know, you're more than welcome to like reschedule. Like you can, you know, and I'm not kind of in a like way that I'm not understanding of their discomfort, but usually if I sense that they're, you know, uncomfortable, but they don't really say something, okay, to back up a moment, you know, we had these kind of physician communication skills classes, and they always said like, if you can tell that the patient's uncomfortable about something, you know, you should say, I feel you're not comfortable, and you should talk about it and explore those feelings. And I'm like, one, I don't have time to explore their feelings about how they're uncomfortable about the fact that I'm a woman. Like, who has time to do that in the office? I don't know about you, but like, and number two,
it's a much bigger issue.
right. And number two, it's like, I don't think if I started an office appointment saying to you, let's explore the fact that you appear uncomfortable by the fact that I'm a woman and you're going to have to show me your penis. Like, no, that was just, I decided to not make that my strategy at all. And instead, I just went like cut straight to the chase. Like, you know, if somebody's coming with Peyronie's, I'm just saying, okay, how long ago did that start? What direction does it curve? How much is it curved? Are you able to have sex? Does it hurt? You know, and then when they start talking about how it does, you know, psychologically devastating, validate that. And, you know, 9 times out of 10 at the end of that appointment, they're like, oh, you were really easy to talk to. Like, you know, you just kind of get the juices flowing. Like, just ask them the questions. People like to talk about themselves. It will happen. And I think most patients are surprised by how easy it is, you know. And I say to people, like, you don't need, you know, your cancer doctor to have cancer, and you don't need, like, you know, your orthopedic surgeon to have broken their leg in the past to understand what your problem is. Like, you want them to be good at their job and collect the information that they need. And obviously you don't do surgery on feet, but you know what I'm saying. Break your leg. You know, but that the person doesn't have to have the same experience to understand and be a good steward of your health, you know.
Right. Right.
And I think most people realize that when they get past like the initial whatever.
That you lack the parts.
Right.
Like, it's okay that I don't have a penis. I can still kind of advise you and work on your penis. Right.
And yeah, I don't have a penis, but I've seen many more penises than you probably have. So
True.
And they're
Yeah.
like, oh, yeah, that's right, that's true. You know, and then there's like occasionally a guy like who will want a female doctor, which I tend to not be like, I don't really love that. Like, I'm glad that they're a supporter of my gender, but I feel like with anything, I just want them to pick me because I'm good at this, and not either way. Like, I don't want female patients to pick me because I'm a woman, and I don't want male patients to pick me or not pick me because I'm a woman, you know, like, yeah.
I have a female urologist friend, and so I get to, you know, kind of hear a little bit of the stories that she tells me. And every once in a while, the majority of the time, her patients are very respectful. There's nothing inappropriate, but every once in a while she has to fire a patient because they are completely inappropriate with her.
Yeah. No, and you know, I'd say that happens like very rarely. I'd say, you know, there are people who definitely have like physiologic responses that you wouldn't expect, but some of those are nervousness, right? Like, there are people who, while you're examining them, will get an erection, but you can tell when somebody is like creepy and when somebody is like scared and they're getting this like fear response. And, you know, with that sort of thing, you just kind of move on, you know, when it's just this like super awkward, like, I'm scared sort of thing, like, you just, you know, you just move on. It's not a big deal. But I'd say one of the more common things is somebody like, I'll introduce myself as Dr. So-and-so, and they'll just refuse to call me Dr. Winter, and, I mean, like, I'm not the sort of, like, I'm not a diva. Like, I don't, like, make reservations at restaurants under Dr. Winter, and I don't, get called Dr. Winter on an airplane, and like that's not my vibe at all. When I go to family gatherings, like I don't talk about myself. Like I'm not an ego, like I'm very low ego.
Call me Dr. Mom. I'm Dr. Winter. Mom. I know you're a mom, but no, I'm just kidding.
Right. Yeah, but from my standpoint, it's just like, in part because we are in an environment where I am going to be seeing you without your pants on. Like, I just think that having these kind of barriers around, like, they're just protect everybody, like I
Right.
think it just establishes a professional tone when something, very intimate is happening. And, I would, yeah. And there are just people who like refuse, like they'll just, and you can tell that they're very specifically and repetitively doing it. And I just kind of find that like disrespectful in this very like wimpy, like, not like passive aggressive way. Like, and I don't know why they need to do that. Yeah.
I get that too. And, and I always find it funny when I walk in the room and I introduce myself as Dr. Yen Shipley, and then they say, "Oh, hi, Nancy," the first time I've
Right.
met them. And it's like, and, and I don't know if you will correct people. I almost never, I think I don't usually correct folks, especially if it's a patient. I mean, it's as long as they know that I'm their physician and that's the relationship that we have, then I kind of just say, whatever. I think internally I kind of go, huh,
Yeah.
but I don't go so far as to correct them. Have you ever had to say, no, it's Dr. Winter, or have you ever felt compelled to do that?
I feel like when somebody has done it, like, I agree. There are people who do that, out of a place of kind of familiarity, or maybe I have an established rapport with them and it's very warm and we kind of are, and then they call me that. And then there are people who, like, I react to it maybe when it seems particularly aggressive.
Mm-hmm.
And I did once have this patient who I think I did say, "Oh, please call me Dr. Winter," and he just was like, "I'm going to call you whatever I want, Ashley," and literally just said that back to me. And I was just
bizarre.
like, oh my, I was like, this is not, this is
not setting the tone for a good doctor-patient relationship, right?
Right. And I would say, like, the exceedingly vast majority of the time, I have a very comfortable and amicable and excellent relationship with the patients. And I actually pride myself on kind of having this warm, fun rapport with people. But, the one or two times that's happened, yeah, it kind of shakes you up.
Right. It's uncomfortable.
Yeah. And I think it's, to some extent, you just have to say, this person, has kind of their own demons, and just like let it go.
Right.
Yeah. But
so you mentioned that you have a podcast, and I bet your like high school introvert self also would have not believed that you would be a podcast host. You could have asked me a year ago. I wouldn't have guessed that I'd be a podcast host. But tell me a little bit about your podcast and how that came to be, and a little bit about what you talk about.
Yeah. So my fiance is a professional comedian. And basically when we started dating, people would hang out with us and basically say, "Oh, you guys should have a podcast because he's just hilarious. And I'm, the lady dick doctor, who specializes in sex stuff." And we said to ourselves,
why didn't you name your podcast The Lady Dick Doctor?
I don't know. We should have. That would have been a great name for it. Really, it really would have been. And we said, oh yeah, that is a good idea. And, just in the sense, like, not only that it would be fun, but also that it would be a way to kind of, uh, put medically relevant, medically appropriate information out into the world, right? And the kind of thinking in my mind at the time was so much about like men's health and women's health and sexuality is kind of driven in the popular sphere by people who don't have any like real content, right? I mean, like women's health bloggers and sexuality bloggers who don't actually have any training in anything. And so we're saying, what, like we could kind of get out there into a medium that was intended towards, like popular consumption and make this approachable and fun. But also when I like say something about hormones, say, oh yeah, I actually reviewed the PubMed, medical literature on this, and this is my response to your question, right? And so we just started doing it, and it's basically formatted as a call-in show. So people email us questions or call in and leave a voicemail with a question. And we were saying if, people are old enough to remember it, like we wanted to kind of be like Loveline, but if Dr. Drew and Adam Carolla were having sex with each other, because that's awesome.
Awesome.
Yeah, so that was the whole idea. And, really like just to, like physicians can so easily have it be that all their medical content is so job related that I think it can like make you burnt out. And to say, hey, I'm going to take the things that I care about academically and intellectually in my profession and make that also kind of like a hobby, but in a way that's like more relaxed, and I'm not worried about like being my efficiency or these like outcomes or the billing or whatever. It's like, oh, I can talk about the urology things but in this like fun way. And I think to some extent it also has like rejuvenated my, like I'll go and review literature, like articles to respond to somebody's question on the podcast. And that's like fun, it makes you remember it better. So I guess it's also kind of like good for me.
And I've listened to your podcast and it is hilarious. And were there any episodes you can think of, or a specific episode you can think of that made you laugh so hard that you snorted or peed, since we're talking urology?
Oh God, I don't even know. I would have to like go back and listen to them. I mean, my fiance like makes me like almost pee myself every day, so I can't like. Most of the conversations I have with him are kind of like that.
It's just funny all the time.
Yeah, he's funny all the time for sure. I mean, there was like some crazy things, like there are some very normal things people called in about, but like one of the main ones that comes to mind was there was an episode where a guy wrote in saying that him and his like identical twin brother had sex with the same woman and now she was pregnant and they didn't know whose kid it was. And like I don't know if that was a real question or not, but it was really interesting to kind of say, like, can you figure out the difference between that? And, what sort of testing is involved in that? And it was also a very dramatic story. So
I also want to know if that was kind of a stand-in situation. Did the woman know that it was not the same guy, that it was actually his brother?
No, I mean, apparently it was a like a menage a trois situation, which is,
oh boy.
Yeah, like she knew what was going on, which was like, I know.
That's awesome.
I know.
Great.
And you're like, oh, this is like a very dramatic, ridiculous situation that like, but you can actually go online and look through peer-reviewed medical journals to figure out what, sort of genetic testing you have to do to differentiate between identical twins in terms of paternity tests. And there is a way to do it. It's, way more expensive, but you can obviously do it because there's like, mutations that happen in your body's cells as we won't go down that line, but there is actually information about it. It was interesting. So
it is possible. It is possible that women could find out which twin was the father of her child.
Yes.
That's
Yeah,
amazing.
and the more interesting thing was that neither of one of them wanted to be the father. So it wasn't like they were fighting over the kid. They were like, they didn't
They're
want to have to
like,
pay the
not it.
child support payments. So,
Oh my gosh.
and I was kind of like, I feel like you guys deserve to split those child support payments. Like you guys, I mean, I'm just saying, like,
You were both there.
yeah,
It could have been either,
right, right. Like if you
Very
don't
tit for
know,
tat.
right, if you don't know which one, then kind of, you guys both deserve to pay, like whatever.
I think and for me, I think about this a lot personally as well, because I feel like laughter and humor drive so much of my life, and yet, I'm a surgeon, and the surgery and risk of complications and all of that is very, very serious, and it's taken me a long time, and I'm still figuring out how do you reconcile humor and laughter and the seriousness of what we actually do, because you're obviously you know how to build a rapport with your patient, and you have this warm relationship, and you have this podcast that is factual and based in science, but also very hilarious. How do you reconcile the two?
I think actually that's an awesome question. I think the two are actually really intrinsically linked. And what I mean by that is, people say that humor is related to kind of absurdity and discomfort, right? And that you can definitely see the types of humor or shows or sketch comedy that leans into discomfort and awkwardness, and I think that the way you kind of normalize the fact that, yeah, maybe there's this lady walking in the room who's half your age and telling you to draw a trowel, like how do you normalize that and just kind of take a sigh of relief with that. And I think that humor is kind of the one of the best ways to do that. I think it's truly inherent in normalizing the experiences that you're going through, and not just from my standpoint, but any person who's a patient and has to just deal with the kind of absurdity of taking the intimacy of their body that's usually kind of so guarded and that you own so much, and you walk into a physician's office and you kind of have to like give that up, and yeah, there are people and physicians who kind of lean into being dry or lean into being like super warm and emotive, but like I'd rather do it with the humor. And I think that's always like throughout my, and also urologists are just like ridiculous. I mean, like urologists, like we just, we have to make like, share dumb comics of, I mean, whatever, dumb penis comics. And, I mean, that's just like what they do all the time. I mean,
Right,
this is
right.
to go into another story. I remember when I was a med student and, I was going through the process of confirming that what I thought I wanted to do was really what I wanted to do. And I remember I was on like a neurosurgery rotation. It was a required rotation. I had not like planned to be a neurosurgeon. And they were doing some like 20-hour inner ear surgery. Like, I mean, it was like a 2-day surgery, but it was something like, it was under the microscope, and they weren't obviously letting us do anything. And I was sitting there like super bored. And I remember I left the OR and I walked into this room where there was a urologist who had no resident or no medical student with him. And there was a dead penis, like a necrotic penis, and he had to cut it off. And I was like, I'm interested in urology. And he's like, good, you want to scrub it in? I was like, yeah, I would love to. And and he was a guy. And so he handed me the scalpel and he's like, okay, go for it. You're going to enjoy this more than I will, like making a joke that like obviously like every woman on the planet has some like little Lorena Bobbitt part of her brain that just like glees, and it was like hilarious. And I was just like, yeah, this is just totally my style, it's like
And I think I had a similar experience as I was thinking about going into orthopedics, except minus the penis. And it was a fracture case where, I came in and I'd said, I'm really interested in this. And they handed me the drill and I got to drill and put some screws in. And so it's nice when you have those champions that just give you a chance. And, and maybe, who knows, in his mind, was it a big deal, or was he even thinking that it would really affect your ultimate career choice. Who knows? But sometimes it's those little things where they just, they hand you the drill, or for you, they hand you the knife,
Yeah.
and it made an impression for you. As you were going through your career choice and your training, tell me a little bit about some of your champions and some of your detractors.
Yeah. No, that's also a great question. So, so many. I mean, I can like think of so many. I mean, I'd say my biggest champion in terms of my training was I had one of the surgeons in my residency just did such a great job at teaching us, and I think I showed a particular interest, and I think I don't know, just did like a great job of empowering me to be really good at surgery. And I think that there are a lot of attendings who will like, you know, like I was kind of more of a slow and careful surgeon, and in my training, and I don't think that's an
I think
inefficient.
many men appreciate that.
Right, right, and so like that's not an inefficiency, right? If you're slow and careful,
Right.
that it can actually be a more efficient surgery than like ripping into things and like making mistakes or getting into bleeding
Having
and like,
complications. Yeah, totally.
right. And I remember I had a co-resident who was like very aggressive, and I felt frustrated a lot because in the OR he would get to do more than me because he would kind of like dive in and start like ripping all the shit out, and like and I almost felt at times like my training favored that. And this one specific attending, was just had so much restraint to give me the time. And he let me have progress that um you know really empowered me, because I felt like at times maybe I wasn't cut out to be a surgeon because I had that kind of aspect of myself. And so like the one real kind of moment that distills in my mind was that we do in our program we did transplant nephrectomies, and we do it like laparoscopically through a single site. And that was like a big deal because you can't mess it up, right? Like none of it, like you can't mess any of it up because you have to give that to somebody else. You're not just taking
Hmm.
that thing out and sending it off to the lab. You're like, that's really important. And he I remember I was the first resident in 15 years that he had been there who he let do the entire thing start to finish, including the most critical part. And I don't want to say like it was anything laissez-faire. Like this, he had been training me for
Hmm.
months and months and months.
Right.
And I remember in that moment when I like got the kidney out and walked it over to the transplant room, all the nurses in the OR started doing this like slow clap.
That's the
Like,
best.
like when you're watching like a sports movie and somebody wins and they come in from the field and everyone's doing that slow clap and they're like, champion. like they all started doing that slow clap.
That's amazing.
I know. And then when I came back in the room, they had made me this little paper crown. I forget what it was out of, but it said kidney queen.
Oh my gosh.
And I remember that
That's
was
great.
probably like one of the happiest days of my life. Like I know like people say, whatever, when you get married and have kids, but I haven't gotten married yet or had kids yet. So that was probably one of the happiest days of my life.
That is awesome.
And that is one of those moments where, the person that I thought I couldn't be, right? Like I thought I was shy and I couldn't do things like be aggressive or do these things, like all of that went out the window. And I said, I did this, and I did
Hmm.
a great job at it. Like the patient did great. So that was somebody who was a champion. In terms of detractors, I mean, when I
I'm
was a
sure there
med
are many.
student, when I was a med student, I remember there was an attending who told me I wouldn't be able to match at the program I ended up matching at because it was a really hard to match into program. And he's like, you can apply there, but you'll never get in there. And he just like said that so matter of factly. And I had like, basically the highest like scores on my boards and stuff in our entire class in med school, and I was just like not whatever. I just didn't have an ego, and I remember he just said that to me and I matched there and I was just like so happy and I wanted to like rub it in his face. Like,
I mean, it's so sad that just still happens. I mean, I talk to women all the time who are interested in orthopedics, and they might be college students or they may be early med students. And for example, on Instagram, they'll reach out and be like, hey, I really thought about going into orthopedics, but somebody just told me I shouldn't do it, that I won't make it and that I wouldn't be a good surgeon, or that women don't do well in ortho. And so I'm sure you had a lot of that. Like, why would you ever want to go into urology? Women don't do urology.
Yeah, no, there were a ton of, actually, it became very popular in my med school class. And I remember it was me and 6 guys um, that went for it. And I think we all actually matched, which was crazy. But I matched at the like highest like difficulty to match in program. Not that like they're all great programs. Like I shouldn't,
Hmm.
it wasn't a contest, but like it felt good. Because I remember people saying that, like, oh, do you think you're going to be able to make it? Like, are you going to, be able to handle that? It's a surgical program, and like not a lot of women do that. And just kind of like making this judgment without being inside my brain that maybe I couldn't do it. And like screw them, because now I like, I finished my residency and I have my board certification and I'm in practice and I do all the things that I told myself I could do. And and I was a loser in high school, so like, so it's fine. You can do things. If
That's
there's
awesome.
anyone listening to this who's in high school, but yeah, and so there were the people like that. And then, I think one of the things that I had mentioned to you kind of before we started the talk was that there's also definitely been, real instances of like,
I think I lost you for a second. Screen froze up. Okay. Are you still there? Oh, I lost your sound. Nope, still no sound. Hold on a sec. Let me chat with you. Okay. Can you hear me? Can you give me a thumbs up if you can hear me? Oh, okay. I hear you now.
okay,
All right.
sorry, I don't know what happened.
So,
That must
oh,
be
it's
the
okay.
connection.
Okay. So, carry on where you left off. I
Yeah.
think you were saying when you were in med school.
Yeah, no, what we were talking about before, as I brought up to you kind of before we started this call, is that I say at numerous instances through my training, I've had to, I've confronted, not just like sexual harassment, but also sexual assault. And, it's something that I think I've been very kind of tight-lipped about, because I think, culturally, particularly as female surgeons, you're like, you don't have the luxury to talk about that, or it's not some, your culture isn't to be complain, right? And the idea kind of is that if you were to talk about that you would be complaining about it.
Mm-hmm.
And I mean, I can even remember back to college where I had a professor who kept saying, like, asking me if I wanted to stay late to do work, and I didn't because I was getting A's in the class. And then he even wrote me an email, and I wish I like had access to this. I mean, it's so like, you can't even imagine this happening nowadays, that somebody would be so dumb to write an email like this. But I mean, remember
Right.
him writing me an email saying he felt like I could benefit from spending time with a much older, experienced man like himself.
That
And
is disgusting.
it was disgusting. And I remember after
Oh
that, I
my
had to like
God.
run out of the back door of that class like every time. And I was also scared that I would have some like retribution in terms of my grades.
Right.
So that's like the earliest memory. In residency, I had an attending who literally told me I had to make out with him between cases, and like
Oh,
kissed me. And he had a son that was like in college, and I was like 27 at the time.
wow.
Like, he had graduated from my program, I think the year I was born. Like, he had gone to that residency. And so, and it was like, that was just like, he was beloved there. Like, this guy had been operating there for like 30 years and was beloved. And, you know, it just like sucked because after that, I didn't even want to tell anyone about it. But what was happening was that they would keep assigning me to his cases, and I
Mm-hmm.
kept not wanting to say anything, but also refusing to scrub with this guy because I just like was sick. Like, it just made me sick. And basically, you know, and I was like the lowest on the totem pole because I was like a junior resident. And what happened was, months later, I had to basically tell the chief resident what had happened because I was just refusing. And they were like, you can't just refuse to do these cases. And, you know, then it finally got back to our faculty. And, you know, what happened was they asked him to stop operating there. And he wasn't on the faculty.
Wow.
He had a private practice and he had privileges there. So his career went on, and he's still very successful. And unfortunately, I still have to see him at conferences all the time. But
Ugh.
and the attending said to me, like, our chairman of our department said to me, you know, you are not the first one to say this about this guy. Like,
Wow.
he's and to some extent, I'm kind of like, if there have been reports of him doing this,
Why was he there?
why was
Why
he
was he
still
still
there?
there?
Right.
Yeah.
Why was that guy still
Yeah.
there?
Right.
And he actually, after the fact, ended up writing me this letter that was an apology. And to some extent, I mean, it's fine. But then he also kind of like blamed it on, you know, like his child having, you know, some congenital issues and it making him feel like less of a man and him acting out because of that. And I just kind of wanted to be like, I don't need you to explain this. Like, you should just say, like, I was a bad guy and I'm sorry.
And that
Because,
was wrong. And it was
right,
wrong.
because there are plenty of people who have kids who have developmental issues who don't act out like that. You know, I mean, that's just
Right.
not. So there was that. Gosh, I get like, this is getting too heavy. There was, after I was done with residency, when I was in fellowship, I was at a conference, and another guy who was probably 1 year into practice, like basically my age, he was drunk, and we were coming back from a dinner, and he invited himself into my Uber, which I did not invite him into, and basically started like manhandling me. And we got out of the car at the hotel, and everybody was staying at the same hotel, and he pulled my pants down in the lobby of this hotel.
Oh my goodness.
Yeah, and I had to run away from this guy. I mean, this is not stuff like people I was like leading on, or, you know, all this discussion about kind of gray zones or when was a date. Like, there was no gray zones with any of this. Like, these were not people I was flirting with or soliciting. Like, fuck that. Sorry.
Yeah.
And this guy, I mean, he, you know, when we had our oral boards, like last year, he was in my same year to do oral boards, and he, you know, was like, why don't we hang out, blah, blah, blah. And he's sending me these like messages through Twitter, direct message. And I was like, do you have any idea why I'm avoiding you, like, at all? And I said, you did this, you did this, you did this, you did this. And he was like, oh, well, like, I thought you wanted that. Like,
Oh my gosh.
I mean, it's just everything you could ever, you know, and I know that we've learned kind of in the past few years that these things, you know, are prevalent across all sorts of fields. But I do think, you know, especially in some of kind of the sexual medicine and men's health and penile implant surgery spheres and conferences that I'm in, you know, there is, not across the board, but selectively, you know, a very persistent like bro culture. And
Mm-hmm.
I'm like totally down to like hang with the dudes. I think it's fun, you know, I have a great time, but not when it crosses that line, you know. And I
Right.
think some of it is enabled by that,
Right.
you
And I
know.
think you know, we talk a lot about women coming together, and I think it's important. I have found a really close knit group of women within orthopedics, and it's really wonderful to have others who have had this similar experience. But I've also simultaneously appreciated how important it is to have allies that are not women
Right.
and men who feel that we should just be treated equitably no matter what our gender or orientation or whatever. And I think if you if we don't have that, then you can't really have cultural change.
Yeah, and I think, like you're saying, me saying all of this is not kind of an anti-man sentiment. It's an
Hmm.
anti-scumbag creepo
Right.
sentiment.
Yeah, totally. And there needs to
And
be somebody to call that out that isn't just the female. And I don't mean in a way like a knight in shining armor coming to rescue you or rescue us, but I feel like that is an important piece of it, in which obviously the behavior is not acceptable, and we do the right things, and we say, no, you can't do this, this is wrong, this is disgusting, and whatnot. But at the same time, I think eh, to be able to create long lasting change, there has to be not just women saying this is not right.
right.
It has to come from both sides.
Yeah. And I say, kind of moving on in my life, at those times when those things happened, I think they were a setback. I can't say I was just so strong and I contained it. Like,
Right.
I definitely had lots of anger, and I think I had like self-esteem issues over it, and professional setback over it. But what I see now, the group I work in here in Portland, Oregon, um, there's just no culture like that. And these are like fun
Mm-hmm.
guys and carefree guys that I work with, and
Mm-hmm.
it's just been entirely different. Like, I would say it's just a 0% creepy it's just a 0% creepy environment. And I work with a lot of people who have the same demographic as
Mm-hmm.
people who were bad actors in the past, and it's just
Yeah.
100% different. And it's
Right.
been, a wonderful kind of transition to say I left these environments where I felt like this was happening again and again.
Mm-hmm.
um, and you can see that it doesn't have to be that way, and it's not like it has to be that you're only around women to make it different. It just can be.
Right.
And I didn't give
Absolutely.
anybody any talking to. It was that way. That was the culture before I showed up.
Right. Right.
So I think that's really
Yeah.
good. So,
So if you were to give a single piece of advice for young women who want to go into a field that is male dominated or male dominant traditionally, or wants to go to urology or a surgical field, what would that piece of advice be?
oh gosh, hey, I think just lean into what your interests are, and don't, you know, be aware of the way that these factors influence things, but have your eyes on the prize.
Mm-hmm.
So a thing I remember in one of my engineering classes, and I forget which one. It was maybe one of our engineering physics classes or something. I remember it took me until halfway through the semester to realize there was not a single other woman in my class. And I just hadn't noticed. I hadn't noticed because I was so focused on learning the stuff I had to learn. And so, and asking questions and coming in with like my questions for my homework. And so it was like noise, it was like noise that I had cut through. And,
Mm-hmm.
and just, just if urology is fascinating to you, or orthopedics is fascinating to you, or any sort of STEM career is fascinating to you, just don't worry about what the other people there, look like, or what their lives look like. Just learn your shit and learn it really well.
I think that's a really good advice. Learn your shit.
Yeah, learn your shit.
Right? Learn your shit.
And if you enjoy
I love
something
it.
and you like it, you'll just be better at it, and you'll have a better
Yep.
career. And it won't be because other people there like had the same genitals as you and you guys ovulated at the same time. Like, it's just
Yeah.
whatever.
So
Yeah.
I always like to make sure for our listeners, if they want to keep up with what you're up to and just learn a little bit more about you, or maybe find your podcast, can you tell the listeners where they can find you online?
Yes. So my podcast is called The Full Release, and you can find that, wherever, if you search The Full Release on iTunes or Stitcher or Google Podcasts, or even, I think we're even on Spotify. You can just find it in all of those places. And we have a website also, thefullrelease.com. and there you can access the episodes as well. And if you want to email us a question about anything, preferably about love or relationships or your genitals, then you can email us at thefullreleasepodcast@gmail.com. And we have a Twitter, which is Full Release Pod, and I am on Instagram personally at Ashley G. Winter is my handle.
Awesome.
So, yeah.
Thank you so much for chatting with me today. It was, gosh, educational and fascinating, and also, as expected, hilarious. I loved it.
Thanks. It was awesome to be here. I can't wait. And yeah.
Thanks again.
Yeah.
Awesome. Well, that was great.
Yeah, that was great.
Thank you so much.
Yeah, no, thank you. It was really fun. So
awesome.
I will I'll send you, do you have like I can send you like a link to the audio file, or if you want like
I have mine is recording both sides.
okay.
But send me your link anyway, just in case for some reason my file is corrupted or whatever. It's just good to have a backup. So do you want to do like a shared Dropbox? Would that work?
Yeah,
or shared Google Drive, one or the other?
Yeah, I'll do that.
If it's not too big, you can just email it.
Yeah, no, it'll probably be too
It'll
big.
work.
The only reason I was saying that is because my like recorder, this one is not.
Oh, you have the fancy one.
Yeah. So my audio for you is going into the mic on the webcam, which is not very good. But this is
cool.
This will be much better. So if your editing person can like mix it, this will be like just sound much better.
Oh, yes. Thank you.
So
thank you so much.
So yeah. So
which one is that? What is that? Tascam?
Tascam. It's not that much money. I think it's like less than $100. Like it's probably like $50. Yeah, it's great.
Oh, great.
The ones, so this has only 2 mic inputs, but the ones that have like 4 mic inputs are like for some reason like way more expensive. But this one, I can like email you the info on it. It's like incredible, and compared to all the audio recording, like I tried all these other mic things and it sucked. And this was just like the audio quality was like phenomenally better. Like I don't think you have to sit, if you use this, you don't have to sit in your closet.
Oh, I know.
You look like, great in there.
Hello. But, here we are.
No, I just remember you posting about that. I mean, it looks awesome, but you don't have to. Like,
that's great.
yeah. It's really, really good. So I'll send you the audio.
Super. Okay, that sounds good. Yes. And then like I have Google Drive, I have Dropbox, and whichever one will work.
Cool.
Yeah.
Awesome.
Either one will work. Thank you so much.
Yeah. Thanks again for having me.
All right. I'll talk to you soon.
All right. Bye.
Bye.